Any man who has failed oral pills, penile injection therapies, shockwave therapies, and vacuum erection devices for their erectile dysfunction may be a good candidate for penile implant surgery. You don't have to fail all of those therapies to be a candidate, and there are some men who are looking for a more permanent solution or reliable solution who also may be good candidates. The penile implant surgery is fortunately generally well covered by certain insurance plans and Medicare. If you have any specific questions, you can always call your insurance company and ask about coverage options for CPT code 54405, and they'll be able to give you more details. My office and myself will always also work with each individual to see if this is a covered benefit. There are two types of penile implants that are available in the United States. There's the malleable 2-piece implant, and then there's also the inflatable 3-piece implant available. The malleable implant has 2 metal coils that are contained within the penis, and it's called malleable because it's bendable. So it's either pointed up or downwards depending on sexual state and when you want it to be up or down. Versus the inflatable penile implant, there's 3 components to it. There are 2 cylinders that go inside of the penis, and it's inflatable, so it either can be completely deflated or flaccid, or completely inflated and rigid. This is all controlled through a pump which is contained within the scrotum, and then there's a 3rd piece called the reservoir. This is tucked up underneath either your right or left lower abdominal muscles, and this is where fluid is stored for the implant. The inflatable penile implant is the more commonly used implant because it provides the most flexibility and it looks the most natural too. The 3-piece inflatable penile prosthesis has 2 cylinders that are completely concealed within the penile corporal bodies. These are either fully deflated in the flaccid position or fully inflated in the rigid position. They are controlled through a pump which is positioned in the dependent scrotum. It's fully internal and concealed. When you want to use the implant, you actually pump up the pump within the scrotum. It'll inflate and draw saline into the implant, and then it becomes fully erect. When you can no longer inflate, it stays fully erect for as long as you want it. Then you push the deflate button, which is located just above the pump within the scrotum, to deflate it. The fluid will go back to the reservoir, which is stored in your lower abdominal cavity, and then things go back to the flaccid state. The penile implant doesn't change any sensation of orgasm, nor does it change ejaculation. It makes it no better and no worse. What the implant does do is it gives you a reliable erection when you want it and for as long as you want it. All components of the implant are fully concealed and contained within the body. Looking from 2 feet away, no one would ever be able to tell that there's anything there. By touch, if you have the inflatable implant, you can tell that there's something within the scrotum, like the pump. If you have a malleable implant, then it is slightly more noticeable because it's always rigid. However, the way that you adjust for that is by bending it down so that it's more concealed. The penile implant is made of a material called BioFlex. It is highly durable and rigid. It will allow for more than 1,000 psi of pressure to flow through the cylinders, which translates into a very rigid erection. It also allows for the ability of the surgeon to customize the type of antibiotic and antifungal that's on there to help reduce risk for postoperative infection. The inflatable penile implant is filled with something called normal saline. It's the same type of stuff that you might get through an IV infusion, and it's perfectly normal. It is not harmful to the patient, even in cases of leak. The penile implant is typically placed through peniscrotal incision on the upper scrotum, just where the penis sits. Usually it's a 1-inch incision for me to tuck in the 2 cylinders that go inside of the penis, the scrotal pump, which is fully concealed within the scrotum, and then the reservoir, which is tucked into either the right or left lower abdomen, underneath the abdominal muscles. For most men, this can be done through a 1-inch incision. However, if you've had a history of an inguinal hernia repair or extensive abdominal surgery, there's sometimes a 2nd incision as well on the lower abdomen. The surgery itself usually takes about an hour during a same-day surgical procedure under general anesthesia. You will go home with a very small catheter and a scrotal drain that get removed the day after surgery in my office. I usually tell men for the first week after surgery, expect to be very sore. It's a sensitive area and it is real surgery. So for that first week, I tell you, milk it and be a couch potato. That 2nd week, you'll start to feel a little bit more like yourself and you'll be on light duty. Many men will start to drive around this time. You might even be able to return to work if you have mostly a desk job. Weeks 3 through 6, you'll start to feel much more like yourself, although you may not completely forget that you had surgery. During that full 5 to 6 week period though, I do restrict you from using it, and then I also restrict you from any heavy lifting. For most patients after that first 5 to 6 week mark, you will be cleared to start using the implant and resume sexual activity. You will go through a teaching session with me in the office where we go through everything. You do have to know that it is a learning process. So just like when you learned how to ride a bike or when you learn how to drive, you can at first be a little tentative. You can be a little bit nervous, but you will get familiar with it with practice. The good news is that practice tends to be kind of fun. At the end of it, you'll actually get very good at it. You become very comfortable with it and it becomes like second nature. Penile prostheses typically last somewhere around 8 to 10 years. There is normal wear and tear to the device, so on occasion, if you reach that 10, 15-year mark and things have worn down and they've stopped working, then we can always put in a new implant and give you a little refresh. For the properly counseled patient who goes into surgery, the satisfaction rate is actually quite high for penile implants. It's upwards of 93%. And that's not only for the patient himself, but also their partner. There are risks that come with any sort of surgical procedure, the penile implant surgery included. I usually tell men that there's 3 major things to really understand. Number 1, after you go through a penile implant, this is the only way that you're going to get an erection. You don't go back to pills, you don't go back to injectable agents. If you want to have sexual intercourse in the future, it will always be with the penile implant. Number 2, there is a risk for mechanical failure. So we just talked about how long an implant lasts. It's about 8 to 10 years per implant. So there is a possibility that it wears out like a reliable car and you need a new one at some point. Number 3, an implant is always at risk for things like infection. The lifetime implant infection risk is usually 1 to 2%. It may be slightly higher if you have a history of diabetes, prior pelvic or penile surgery, chronic immunosuppression, or if you're on chronic steroids. These will slightly increase your risk for infection, but it does not mean that you're not a candidate. It's just a risk that we kind of take on with surgery. In general, other risks, things like erosion, penile shortening, penile curvature,